protect yourself. 3 important ways to slow the spread. Wear a mask to protect yourself and others and stop the spread of COVID-19. Stay at least 6 feet, about 2 arm lengths, from others who don't live with you. Avoid crowds. The more people you are in contact with, the more likely you are to be exposed to COVID-19. Wear a mask. Everyone 2 and older should wear masks in public. Masks should be worn in addition to staying at least 6 feet apart, especially around people who don't live with you. If someone in your household is infected, people in the household should take precautions including wearing masks to avoid spread to others. Wash your hands or use hand sanitizer before putting on your mask. Wear your mask over your nose and mouth and secure it under your chin. Fit the mask snugly against the sides of your face, slipping the loops over your ears or tying the strings behind your head. If you have to continually adjust your mask, it doesn't fit properly, and you might need to find a different mask type or brand. Make sure you can breathe easily. Stay 6 feet away from others. Inside your home, avoid close contact with people who are sick. If possible, maintain 6 feet between the person who is sick and other household members. Outside your home, put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may be able to spread virus. Stay at least 6 feet, about 2 arm lengths, from other people. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Avoid crowds. Being in crowds like in restaurants, bars, fitness centers, or movie theaters put you at higher risk for COVID-19. Avoid poorly ventilated spaces. Avoid indoor spaces that do not offer fresh air from the outdoors as much as possible. If indoors, bring in fresh air by opening windows and doors, if possible. Wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, after touching animals or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow and do not spit. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use a household disinfectant. Use products from EPA's List 10, Disinfectants for Coronavirus, COVID-19 external icon according to manufacturer's labeled directions. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you are running essential errands, going into the office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. Get vaccinated to protect against COVID-19. COVID-19 vaccination is especially important for people who may be more likely to get very sick from COVID-19, such as older adults and people with certain medical conditions. People with underlying medical conditions may get a COVID-19 vaccine as long as they have not had a severe or immediate allergic reaction to the first dose of a COVID-19 vaccine or any of the ingredients in a COVID-19 vaccine. Protect your health this flu season. It's likely that flu viruses and the virus that causes COVID-19 will both spread this fall and winter. Healthcare systems could be overwhelmed treating both patients with flu and patients with COVID-19. This means getting a flu vaccine during 2020 to 2021 is more important than ever. While getting a flu vaccine will not protect against COVID-19, there are many important benefits, such as 1. Flu vaccines have been shown to reduce the risk of flu illness, hospitalization, and death. 2. Getting a flu vaccine can also save healthcare resources for the care of patients with COVID-19.